Good morning, everyone. We are the Group 4. We will be discuss health hospital. Hospitals are very important institutions for the economic and social well-being of society. Their curative and rehabilitative functions enable them to restore individuals to being productive members of society and for those individuals to enjoy the benefits that can be derived from it. The success of hospitals in their mission is therefore important. This success is highly dependent on the hospital's managerial capability and understanding of how hospitals are managed well, contribute immensely to future success in hospital management and towards the enhancement of their roles in society.
A hospital is made up of patients, doctors, and other members of the health team who work together in a building or collection of buildings to satisfy the needs of sick and injured people. The contemporary hospital has typically established outpatient facilities as well as emergency, psychiatric, and rehabilitation services to better serve the community's diverse needs. A hospital is a community health agency since a person comes to the hospital from his or her neighborhood and returns after receiving the necessary hospital care. They help residents afford health insurance and reduce costs due to preventable and chronic conditions. Healthcare industry, sometimes known as the medical industry, is a business that sells goods and services to people who need curative, preventative, rehabilitative, or palliative care. The healthcare sector is made up of businesses dedicated to medical condition prevention, diagnosis, treatment, and rehabilitation. Treatment can be delivered in the form of items or services, and it can be done discreetly or openly. The healthcare business is one of the world's largest industries, and it has a direct impact on health and well-being within every country. The Philippine healthcare system is made up of public and private healthcare diagnostic and treatment institutions that are dispersed over the country. PhilHealth is a government-owned business and is in charge of public healthcare. Although PhilHealth covers some medical treatments and expenses, including as inpatient care or non-emergency procedures, it does not cover all medical treatments and costs. Barangay health stations with midwifery and rural health units that are expected to be managed by a team consisting of a physician, a nurse, and midwives make up the government healthcare system, which is primarily targeted at low-income populations.
Role of hospitals. As in order dynamic societies, the role of hospitals has constantly evolved and expanded to meet the growing needs of the population as well as the harness the hospital's potentials given its unique position as an institution in society. Some views, opinions, and observations on the role of Philippine hospitals are presented below. Solin et al. 1991 point out that hospitals have the primary role of providing services for people who become ill from disease that are not readily preventable by non-health sector activities, use safe water resources, proper nutrition. Expenditures for preventive health services comprise a large component of the total health expenditure. Health status may be significantly raised if all preventive measures are exhausted so that the relatively high-cost curative measures, those that hospitals are meant to provide, can be minimized. It is therefore necessary to access the improvement in health status brought about by hospital services, field services. The walls of hospitals have vanished according to Dr. Thelma Navarrete Clementi, 1992, by extending not just curative but also preventive, immunization, health education, and rehabilitative services to the communities. According to Dr. Jaime Zigal-Bestan, hospitals are positioned to take on a role that goes beyond curative and rehabilitative care, the practice of primary health care, which he describes as health in the hands of the people, due to the phenomenon of rapid urbanization and the high concentration of hospitals in urban areas. A hospital is defined by the Department of Health as a place of devoted principally to the maintenance and management of facilities for the diagnosis, treatment, and care of individuals suffering from disease or deformity or in need of additional medical or nursing care, as defined by Republic Act 4226. It is defined as a facility with beds or cribs available for 24-hour or longer use by patients for a variety of treatments, including disease, conditions, injuries, deformities, or abnormal physical and mental state, maternity cases, and all institutions such as sanatoria or sanatoria care, infirmities, nurseries, dispensaries, and other names by which they may be designated. Crisostomo 1976 characterizes a hospital as the most complex organization in modern society, with extremely fine division of labor and repertory of technical skills. The major hospital embraces multiple goals: patient care, teaching, and research. It is a mixture of a hotel treatment center, a laboratory, a university, and a prototype of a multiple purpose organization fully prepared to give its patient well coordinated and highly specialized medical care. In summary, hospitals have multiple roles: a place and treatment, the ill, and a workshop of medical practitioners, a training and a research institution, a provider of community services, and finally, a place where patient and the hospital personnel and the community people can work together for their common benefit.
Hospitals continue to provide overnight care for patients too ill to stay home, but advances in science, technology, and training have made modern hospitals not only sites of care but also sites of cure. After being formed and continue to develop, healthcare teams interact dynamically and have the common goal of delivering health services to patients. Hospital industry provide a variety of health services with a focus on the people's health, such as assisting them in acquiring access to health-related services, information, and health issues. A hospital is in a unique position both as a service provider and an employer to provide a focus for disease prevention and health maintenance based on a greater understanding of the relationship between social and physical environment and lifestyle factors on health, developing hospitals to become a resource for health instead of merely another link in the sick care chain requires a substantial change in philosophy, management, and practice. Examples of healthcare services are mental health care, dental care, laboratory and diagnostic care, substance abuse treatment, preventative care, physical and occupational health, nutritional support, and prenatal care, and many more.
Characteristics of hospital industry. First is intangibility. Healthcare services being highly intangible. To beat this intangibility, the irony of modern marketing takes place, such as use of more tangible features to make things real and believable. Ways to overcome this drawback. Visualization. The industry has to make available visualization so that search and experiences qualities are crystallized. For example, press releases, distribution of brochures and leaflets, newsletters, digital marketing, and media campaigning. Second is inconsistency. Quality of service offered differs from one extreme to another. This is because of total dependence on human interactivity or playing human nature, because human beings can never mechanize or replicate themselves. Ways to overcome these drawbacks. Training. A scheduled training of employees in respect of the work or services can prove to be the best solution to this drawback. For example, make it as a mandatory for doctors and other health personnel to undergo 6 weeks of training every year or 6 months of training every 6 years. Third, inseparability. Service transactions becomes unique because it mandates, during transaction, the physical presence of the provider and the consumer. Ways to overcome this drawback. HR management. This is the best way out of the setback. For example, the training, internal branding, cultivating brand culture and brand ambassador concept, reward system to promote brand champions. Fourth is perishability. Services are intangible. They cannot be packed and neither can be stored nor can they be inventoried. The implication is that the service has to be produced and consumed instantly. There is no scope of storage. Ways to overcome this drawback. Managing demand and supply. That is to say that there has to be provision for all sorts of stipulations and all times to the greatest possible extent. For example, the service developments according to the market needs.
The next is the function and role of a hospital. The main function of a hospital is to provide the population with complete health care. It also functions as a center for the training of health workers. A hospital is generally a vital part of a social and medical organization. The hospital is an integral part of a social and medical organization, the function of which is to provide the population complete health care, both curative and preventive, and whose outpatient services reach out to the family in its home environment. The hospital is also a center for the training of health workers and for biosocial research. And there are some of the broad categories of hospital functions. First is the medical care, which involves the treatment and management of patients through the staff of physicians. Second is the patient support, which relates directly to patient care and includes nursing, dietary diagnostic, therapy, pharmacy, and laboratory services. Third is the administrative, which concerns the execution of policies and directions of the hospital governing discharge of support services in the area of finance, personal materials and property, housekeeping, laundry, security, transport, engineering, and board and other maintenance. Beside this are some major responsibilities coming under administrative service. The role of a hospital. In low and middle income countries, a hospital is often the first stop for citizens that experience illness or the last stop when their health needs aren't met by primary care, and as countries grow. Community hospitals provide a wide spectrum of health services, situating them at the interface between primary, secondary, community, and long-term care services. Their rules have to be set in the context of the evolution of the overall hospital service delivery structure in different countries. The greatest benefits are seen to lie in their small size and proximity to people's home and their flexibility to respond to local need. Challenges include attracting suitable staff and maintaining a diverse skill set. Functions and roles of social workers in hospital. Social workers play a critical role in hospital settings by helping patients and families address the impact of illness and treatment. Social workers, as part of the healthcare team, provide assessment and appropriate interventions to aid the patient in achieving optimum recovery or rehabilitation and quality of life. Social workers often have specific expertise in areas such as general medicine, emergency work, pediatrics, geriatrics, oncology, neurology, psychiatry, and palliative and end-of-life care. What services do social workers provide? Social workers in healthcare commonly provide individual, couple, group, and family counseling, crisis intervention, patient or family education, resource referral and advocacy, in inpatient and outpatient settings, because social workers can provide both psychosocial care and other services to the patient and family. Duplication of services is reduced. Consultation with medical and allied health professionals is implicit in developing and implementing treatment plans. Social work services can include all or some of the following. First is the psychosocial assessment. Screen for high risk. Determine need or eligibility for services. Identify strength or coping capacities. Assess informal network of support. Second is the counseling psychotherapy. Assess role of emotional and social or cultural factors on health status and behavior and provide appropriate interventions, enhance coping capacities related to the feelings of loss, grief and role changes. Assess and intervene related to mental health concerns such as anxiety, depression, anger management. Third, Third is the patient or family education. Educate patients and families to facilitate understanding of hospital processes, increase understanding of illness or disability on relationship, and facilitate life transitions when health conditions require a modified lifestyle. Fourth is the resource counseling and discharge planning. Identify and address barriers to discharge, locate resources, identify options and available support, facilitate referrals and applications to government or community agencies, advocate for access to resources, coordinate referrals and or placement plans, assist patient and family to emotional prepare for transitions, prevent readmissions for non-medical reasons. Fifth is the supportive care to outpatients. Assist outpatients to identify and receive appropriate resources and support, thus enabling increased compliance with treatment and preventing or unnecessary hospital admission. How do social workers contribute to the overall goals of healthcare organization? First is the risk management. Ensure effective communication through psychosocial assessment and follow-up with the patient and family to address potential conflicts or complaints, or in a response to a concern to reduce dissatisfaction and or litigation. Second is the progress development. Provide leadership and participation in program planning and evaluation within diagnostic or unit-specific teams, programs, and corporate initiatives. Third is the community linkages. Chair or participate in hospital and community committees or boards. Next is the research. generate discipline-specific or interdisciplinary psychosocial research initiatives addressing psychosocial dimensions of illness and outcomes of intervention. And next is the teaching or educations. Initiate and participate in teaching activities by presenting at workshops, in services, rounds, or conferences, provide training to healthcare colleagues, students, and staff in community agencies, and offer education to patients and families. The Southern Philippines Medical Center, or the SPMC, is the largest hospital in the Philippine Department of Health System, with an approved bed capacity of 1,200 by virtue of Republic Act 9792. It is situated in one of the most populous Philippine cities. Being an end referral center with several highly specialized clinical services, SPMC also caters to the health needs of patients from different parts of Mindanao and the country. There are already proposals to further increase the bed capacity of SPMC to 1,500, which will place the hospital among the biggest tertiary level teaching, training health facilities in the country. It's not a hospital of Davao City. It's a hospital in Davao City. It's just located in the city, but it's not a city hospital. It's a regional hospital. The Davao Regional Medical Center in Tagum City and the SPMC are the only tertiary hospitals in the region. SPMC is the only public hospital in the city. Only SPMC was initially allowed to accept COVID-19 patients. Davao City Mayor Sara Duterte ordered the private hospitals in Davao City not to accept patients with COVID-19 to limit contamination. It has been the main receiving center for confirmed patients in the Inter Mindanao. This means no matter how rich or poor you were, even if you wanted to stay at an expensive private hospital, you're going to end up in SPMC. It also had its own lab which could confirm COVID independently. It officially became the largest hospital in the Philippines after it was authorized to expand its capacity to 1,500 beds when the Republic Act No. 11326 was approved on April 17, 2019, surpassing that of the Philippine General Hospital's 1,334 beds. It's famous for its pediatric cancer care. SPMC's Dr. May Dolindo is the medical lead of the St. Jude Global and the World Child Cancer Funded program in the country. SPMC also has a House of Hope, which has temporary lodging for children with cancer and their families, as many of them are not from Davao City. It's more than 100 years old in 1917. The humble hospital was started for Sakadas. In 1920, it became a concrete hospital with 50 beds, led by Dr. Simeon Makasait Sr. In November 1921, it became a modern hospital in Mindanao, complete with dispensary and their dormitory for nurses and doctors. In 2008, the hospital's name was changed to Southern Philippines Medical Center to reflect its ongoing expansion and growing ability to cater for the needs of patients not only in Davao City but throughout Mindanao.